Minister, the Labour Party welcomes the provisions of this bill, both in the area of inpatient charges for 16 and unders and the measures which we'll be bringing as an amendment in relation to contraception services. That especially is a very progressive measure, one that will make a real difference and is an initial or an early step in what will be should the action plan on women's health be delivered, a further more comprehensive suite of measures in relation to contraception and women's health in general. So that's to be broadly welcomed, and I think it is something that will be delivered and is deliverable, which as we know, is the proof of the pudding in anything the government or we in politics do. On the inpatient charges, Minister, this is again very welcome. We would like to see a commitment in the upcoming budget for it to be extended to remove all inpatient charges. The cost through the department's own costings for 2018, 2019, 2020 would be in around the 30 million mark for the removal of all inpatient charges. Now, I know that's a significant figure, and it's not something that can be just found down the back of the department's couch, but in the overall scheme of the health budget, it is not a huge amount, and given the cost of living crisis we're facing and the desire for free health access at the point of delivery, it would be great to see if this measure will be extended in the upcoming budget. It's a key part of the pre-budget submission of the Irish Cancer Society, as I'm sure you'll be aware. And we had a debate recently in the Dáil on that, and they had a meeting, a drop-in session over in Buzzwells earlier this week. So a fantastic pre-budget submission, really well costed, asking for the abolishing of all inpatient charges, but also ending the practice of debt collections in our health service. And it's something I'd just like to bring up again, because this is something that is linked to inpatient charges when people can't afford to pay them as they exist at the moment. And we know they can be capped at €800, but within a month it can go to debt collection. We mentioned the cost of living crisis again, how difficult things are for people. No one plans, no one wants to be in hospital. It is in many almost all times a surprise charge that can be imposed on an individual or a household, and it's something that the hospitals and the hospital groups and our publicly funded health service are outsourcing, and whether you're suffering or recovering with or living with cancer or any other illness, or indeed in recovery from an illness after your stay in hospital, an automated phone call from a debt collection service is highly distressing, and something that we, as a nation, as a state, as a public health service, shouldn't tolerate. So I would ask you, Minister, to re-examine that. That's an ask that's not going to go away, and I think it's something that has broad support over here. And I'm sure you and many in your party and your government parties do not want to see this, do not want to stand over a private debt collection service operating in our public health system. So if that's something that could be looked at, that would be most welcome. But I wasn't going to mention the other issues. I was going to stick to the bill, but as you included them in your contribution, I'd like to speak to them. In the area of contraception, I put a number of parliamentary questions down in relation to the provision of community-based vasectomy services. We have a real problem in Dublin in relation to GP practices that have either retired or have passed on, and apparently there's only one left that's providing this service. So there were recommendations made by a working group in 2017 or 2018, which the HSE and the department were all for. When the pandemic happened, they didn't get it implemented. So I'm asking for you to, through the parliamentary questions, which will come up in a couple of weeks, will come across your desk, if you could have a look at that. Again, it's an important public health measure and contraception measure, and something that I think everyone is in your department is in favour of delivering on, and I'll just ask you to give it some attention. The delay in the continuation of the free GP care scheme is something that we feel very deeply. The Labour Party brought this in when we were in government. We're very proud of it. Everyone likes it. Everyone remembers other stuff we did in government. No one ever seems to remember that we did that in government. Okay, when they're up here crowing about it not being extended. If the IMO and GPs are dragging their heels on it, you need to call them out. We need to have this continue. It's 7 years now in existence, and we haven't been able to, your government, the previous government, haven't extended it to 6 and 7 year olds, the modest increase. We should be well beyond that. We should be at a stage now where we're looking for all, if you're taking the 16 and under age group for the reduction of inpatient charges, we should at least be there for the extension of free GP care at this stage. So it is, I think the GPs and the IMO are getting away with blue murder here in terms of dragging their heels on this, and I think you need to be more vociferous in calling them out and demanding that they sign up at a minimum to get the 6s and 7s, and then we start getting 8, 9s, 10s primary school students and start getting secondary schools as we move towards universality and free GP care, because children are more likely to go and visit their GP than they are to be an inpatient in a hospital, thank God. So it is, again, a more constant, a more regular cost of living issue. And we now have tied into it accessibility issues and trying to get more GPs on stream, etc. But the fact that this has stagnated now for 7 years and not progressed, I don't think it's something you want to stand over, Minister. I think you'd like to deliver at least what is now a very, very modest extension of the scheme to 6 and 7s. Before the end of this year. It can't just be another couple of lines in a budget without any delivery. The work on new medicines is really positive. There's always going to be new medicines out there and therapies that we're going to want to bring in, and we're going to call for that when they happen, and they're usually going to happen to people with young people or people with chronic diseases, and that's just that, and we just always need to strive to make sure that we have the best new therapies available within our public system for people in Ireland who are sick, no matter what age they are. But you can see the work that's being done, and that's going to be ongoing. The dental treatment services scheme, Minister. I know there's 2 paragraphs here. I did read the second paragraph as well, but. You do say that you'd hope that this significant additional investment in the dental treatment services scheme would attract more dentists. It won't. The way the dentists at the moment, they turn their back on the scheme. They believe the scheme is totally outdated. It is archaic. It does not represent value for them. It does not represent dental services now, and. I've raised this, Deputy Cullinan, Deputy Shorthall, we've all raised this now over the last year and beyond, but it seems again that when we've asked about the negotiations or engagements between your department and the representative body of the dentists, that it's next quarter, or there'll be a meeting and then sure we'll come back. There doesn't seem to be a sense of any real momentum, any real engagement, and you may throw money at it or allocate money at it. But if these dentists don't want to take part in the scheme, if they feel the scheme is structurally unsound, they will remain outside of it. And we are dealing with issues in our constituency clinics and in our offices every week from people who are unable to access dental services. It is acute. It is chronic everywhere. It is very acute on the north side of Dublin. And like, if I'm out for a canvas for a minimum of 1 hour, it'll come up at least once on the door. It'll come up. It's just always coming up now because it's impacting so many people. But because maybe people don't go to the dentist every week or every month, maybe it doesn't have the momentum it should, but it is impacting them. They're forced to go private, or and they might get whatever emergency procedure they need done to get them over that particular dental issue. And then maybe that individual then is sated for a while, but the issue continues and the dentists are no closer to re-engaging with the scheme. They're not going to re-engage with the scheme as it exists now. It has to be torn up and redone again, and that's just the reality of it. And it's going to be expensive, and it's going to be uncomfortable, but it has to be done. Otherwise, we are, the way it's structured now, resigning people on medical cards to be outside public access to dental treatment, and that is a massive retrograde step. So your department, the representatives of the Irish Dental Association need to get into real engagement on this. COVID now is in a different space, and that was the reason that was given for those couple of years as to why certain things couldn't progress. It's not here in the way it was. So there has to be the space for us to resolve this issue. And what I appreciate your allocation of more money and the PRSI and scale and polish and all the rest, and that is helping some people. The structural issues with the DTSS scheme have not been addressed and seem no closer to being addressed. I will finish by going back to the provisions of the bill, because this is important. 16 and unders now will not be charged for inpatient services in our public hospitals. That is a very positive and progressive step, and that will help households. It will help the bill payers in families whose children have been in hospital, and that is to be welcomed. But one thing that I should have mentioned during about the briefing of the Irish Cancer Society the other day, in terms of inpatient charges and in terms of how they can accumulate. One of the patient advocates there, who's recovered from cancer, had a 2-year treatment through the private system. That person calculated that they paid, including their insurance premium and the €75 excess they had to pay each of the 2 years, they paid less than if they had have got the same treatment through the public system, because of the inpatient charges that they would have incurred. It would have been about €400 cheaper for them to have gone private with their private health insurance than it was through the public system. I'm doing up a note on that to you, Minister, which I'm going to send to you, because it is a kind of a perverse example of how our health system isn't functioning in that regard. When it actually is more expensive when you're paying more on the public system than someone who's on the private system. Obviously, I want the public system to be free at the point of use. I want it to be a world leader. I want it to excel. I want private health insurance to diminish to such an extent that people don't want it, don't need it, because our public health system is so good. And that is the vision of Sláinte Care, which is silent really on private health insurance. It's an implication more than anything else. The implication is that if Sláinte Care is delivered, our health service will be so good, no one will want private health insurance. And that's where I believe we need to get to. But anyway, I just think that's an example just to have there, because it certainly took me by surprise the other day. But this is a step forward in the provisions of the two main provisions of this bill, and we look forward to supporting it before the Dáil recess. Thank you.